Alright, so I switched spots because of technical difficulties because the camera cord fell out. So what I'm going to do now is I'm going to put my sterile gloves on. And I wouldn't have touched the back of that. So coming back over here, I'm going to assess the insertion site and I'm going to assess the length of the catheter. So 1, 2, 4, 5 centimeters out, based on the dots. So the next thing I'm going to do is I'm going to open up these, remove the PICC line, and using an alcohol swab, I'm going to remove the previous stat lock. Also, when I was assessing the insertion site, I noted that it looks good. There's no issues. It doesn't look like it's infiltrating or anything like that. So using an alcohol swab, I'm going to remove my stat lock. And throw that out. And I'm also going to remove my steri strips at this point. Now, using my chlorhexidine swab, I'm going to cleanse the insertion site and my catheter. And then using a vigorous motion, multi-directional motion, I'm going to cleanse the skin underneath where my new dressing will be. And that wouldn't have happened in practice, but I'm going to finish now. If that would have happened in practice, I would have gotten a new swab. Alright, so then I'd let it dry for about 30 seconds, but since this is plastic and I'm in the Sim Center, I'm going to use a piece of gauze to dry it off, just to save time. Now, using skin prep, I'm going to cleanse the spot where the new stat lock is going to be. I would also let this dry. But since this is plastic, it's going to take a while. Now, the next thing I'm going to do is, with the arrows pointing towards the insertion site, I'm going to put this new stat lock onto the PICC line. And once that's dry, I'm going to place the new stat lock onto the skin and adhere it. The next step I'm going to do is I'm going to get my steri strips out. Wouldn't have done that. I'm going to create an X. I'm folding these over so that they're easier to get off the next time the next time the dressing has to be changed. I'm also going to put one just below the stat lock. or just above, I guess. Throwing this out. I'm then going to place my new dressing on top. Now removing the top piece. I'm going to adhere it over top. Now, one thing I wouldn't have done is put the packaging for the new caps into my sterile field. Next thing I'm going to do is I'm going to do my cap change. Since my PICC line is valved, I do not need to use a Heparin lock. I will just use normal saline. So I'm going to prime both caps. Oh, one thing I forgot to do in this one, that I'm going to do on this one, is I forgot to clean the cap. With an alcohol swab. The next thing I'm going to do is assuring that the arm is below the level of the heart. I'm going to loosen the previous caps. And remove them. When I put the new caps on, I'm also going to flush. The bag came off.
That's okay.
So I would flush them each with 10 milliliters of normal saline. Next step I would do is I would take off my sterile gloves and throw these away. And then I would clean up and do my... Alright, Mr. Nicholson, I'm just going to clean this up and then I'm going to go and get your antibiotic ready, alright?
Okay.
How are you doing?
I'm fine.
Okay. Now I would throw all this away. Now we come over here. Now the NSAID has to be reconstituted, so I would add 6 mils of normal saline. But first I'm going to make sure that the normal saline is compatible with the NSAID. Yes, it is. So I would wash my hands first, and then I would come over here. Now I would push 6 mils of air drop 2 mils of this and 8 mils of normal saline. I would also have alcohol swabbed the bottles before putting a needle into them. And then put the needle into my sharps. Grab gloves, alcohol swabs, and my flush. Put my gloves on. I would rewash my hands first, and then I would put my gloves on. Hi, Mr. Nicholson. How are you doing? I would also have brought my Mara over.
I'm good.
I keep forgetting things. Hi, Mr. Nicholson. I've got your medication here. Can you tell me your name and your date of birth?
Nicholson. And May 12th, 1943.
All right, perfect. All right, so I would put it into the distal. And I'm gonna push this 2 mils every minute. And to not waste time, I'm not actually going to push the whole thing. But I would have had a watch with me, and I would have watched the clock and pushed 2 mils every minute. Next thing I would do is I would flush the line with normal saline. I would have also pulled back on the med to make sure that I was where I was supposed to be. And after flushing, all right, all done. So then what I would do next is I would clean up this and I would do my charting.